And I'd like to recognize Councilmember Lancman for questions.
Good afternoon.
Good afternoon.
So I want to ask you questions along two lines of inquiry. One has to do with the mental health issue and the extent to which Rikers Island has really become the city's almost frontline mental health services department. And the second has to do with the increase in violence in the jails and its possible relationship to punitive segregation and changes that have been made there. Regarding the terrible tragedy of Mr. Murdo, you know, it's almost a perfect storm of the city's failed policies on homelessness, mental health, veteran services, and corrections. And to a certain extent, I feel that this is unfair to you. I don't think that you signed up to be mental health professionals. I doubt that most men and women who join the corrections department as correction officers expect to be mental health professionals, but that's what it's become. So can you just, I know you've talked about it, but can you just tell me the mental health training that is provided to frontline correction officers, what is it and how does it compare, for example, to the training that a staff person in a mental health facility might receive? Because when you have a population that's almost 40% with a mental health issue, including a significant percentage of people with severe mental health issues, I think it's fair to compare the training that mental health professionals receive, not necessarily physicians or direct caregivers, but the staff in those facilities, how that compares to the training that your officers receive.
I think I'll explain the training in a second, but I think it's important to understand one.
Can you just put the mic?
Yeah, sorry. I think it's important to understand one key piece of information, which is that correction officers are not entitled to know an inmate's particular diagnosis or treatment plan. That's protected medical information. It is not information available to them or to any of us. It's exclusively the province of the healthcare provider and the Department of Health. So we're limited in this way in the way we can.
Well, let me stop you because that I didn't know that. That's extraordinary to learn, and to say that you're limited in your ability to care for the inmate in your custody is an understatement. Is that a function of state law or federal law or city policy?
It's a function of state law. I believe it's Section 18 of the Public Health Law is even more restrictive than the federal HIPAA law in terms of protecting health information.
Before we go on to the training, and I'm sorry to interrupt you, but I didn't know that, and I find it extraordinary. Is it fair to say that that lack of information about an inmate's mental health status, condition, and presumably what that might mean for their behavior severely limits the ability of the department to care for their needs as well as secure the inmates and the correction officers around them?
I think what I would say is that it's a challenge, certainly, but that what it requires then is communication between the healthcare staff and the facility staff that in another setting you might not necessarily need because everybody would be able to know everything about the person in front of them. What I often say when I talk to staff is I don't necessarily, given the circumstances, need to know what the diagnosis is and what the treatment plan is and what medication somebody is taking for the medical staff to tell the officer, I've changed a medication, please let me know if his behavior changes, right? It requires a different kind of communication and a language that we have to learn to speak to one another inside the facilities so that we can effectively share information across the two agencies in a way that is productive for everybody and obviously foremost for the inmate patient, him or herself.
I would imagine that the incredibly close quarters that your officers operate in, their ability to read and interact with the inmates, and for the inmates' benefit, for their own safety, for other inmates' safety, I just have to think that not knowing an inmate's mental health diagnosis, at least if that mental health diagnosis is accompanied by some particular kind of behavior, or that it might trigger certain reactions to certain kinds of behaviors or inputs, I would think that would be critical if I was a correction officer to know, who I'm dealing with.
So this is actually a perfect segue into your question on training. Our training in the past, and a large portion of our training still will be, this is what you do when you find somebody with a mental illness or when you think somebody might be mentally ill. We have a checklist of behaviors. We ask the officer to circle the behavior they've seen, write a note, call a supervisor. We take the inmate to a clinician and have that more professionally assessed. But the changing dynamic, as the Senior Deputy Commissioner was mentioning earlier, is we're doing a lot more training with the Health Department, with some expertise from the State Office of Mental Health informing it, to teach officers symptom recognition, right? You don't have to know for sure that this is a diagnosis to start to understand what behaviors look like and then what triggers those behaviors and how to de-escalate them, and de-escalate them non-violently before they result in an incident. We're having very, very good success with that in our CAPS unit, which is a clinical setting where it's non-punitive, but it's a group of inmates with serious mental illness and with problems adhering to the jail's rules. They're going into these units, and we are not seeing anywhere near the levels of violence that we saw when they were in general population. It's a therapeutic setting, and the officers have received significant training in conjunction with the healthcare staff. There's a real team environment built, and so it's a model that we're trying to build off of and grow out, from the CAPS unit and the RHU units into mental observation housing, and then eventually, of course, into the general population as this situation gets more concentrated.
Now, you're corrections professionals, and I'm sure over the years the department has developed policies and procedures as correction professionals. As the population at the jail, at Rikers in particular, has become more and more populated, people with mental health issues, has the department's recruiting or testing or initial training changed in any way to reflect the change in the population at Rikers?
I don't think anything I can point to specifically has changed. The experience that officers face over the last couple of years, I think, has manifested itself into the training and some of the scenarios that they're trained on in the academy as they go along, but nothing in the recruiting part has changed.
Right. Well, again, it is unfortunate that Rikers Island has to some extent replaced the mental health services that the city maybe used to have provided or might ought to provide, and now the jail is something more than just a jail. Let me ask you about the issue of the violence in the jails. Mm-hmm. You've acknowledged it. It's gone up dramatically. It's unacceptable to you, and it's unacceptable to us and to the public as well. I know that the department is trying to make changes to the segregated punishment, and I noticed that there was, I think, maybe a 15% decrease approximately in the segregation over the last year or time period that it's been measured, and there has been an increase in the amount of violence both between inmates and towards staff. Now, I'm not a corrections professional, so I'm not going to jump to conclusions. I do understand that administrative segregation or punishment segregation is a tool to try to control inmate behavior and misconduct. To what extent, if any, has the decrease in the punitive segregation caused this spike in violence, and to what extent has the department instituted other measures to substitute for the threat of punitive segregation?
Okay. It's very hard to correlate the exact, increase in violence to either a small decrease or a decrease in punitive segregation. What I would say is, I think punitive segregation as it exists is ripe for reform. There's different things that could be done. As far as the amount of inmates that should be in punitive segregation, the type, I think that's all debatable, and that's something that I know the Board of Correction is actively involved in looking at rulemaking on, and I know there's a sort of momentum nationally to reform and change it, and I think in large measure the incoming commissioner is going to be addressing that head on. But what I would say is things such as the restricted housing unit for inmates with underlying mental health issues, I think we've seen that if we can provide a setting that is secure and that's open and that is robust with staff and activity, I think we can accomplish the mission, which would be to stop a violent incident or stop things from happening. We're not about punishing the inmates, so to speak, versus making sure we protect everybody else. So if you have a violent-prone individual, if you have somebody who's impulsive and has demonstrated an ability to, assault other people, we have a duty and a responsibility to protect everybody from that person. And traditionally in corrections, it was done through punitive segregation. I think everybody's sort of rethinking the benefits and the pros and cons, so to speak, of that, no pun intended. But the reality of it is, we are exploring different ways of doing it. We're exploring, we're doing certain things like conditional discharge and other things for inmates in punitive seg so that there's a light at the end of the tunnel for them. There's an understanding or a reason to conform to the rules. And in restrictive housing unit, we're going jointly with the Department of Health above what their initial incentives were for inmates to behave. We're getting into activity rooms and different kind of things, starting to think about what the inmate can possess in their cell and how we can, what's important to somebody. We're not looking to make it isolation. We don't want to isolate anybody. We want to protect people from each other if necessary. So what that individual possesses in a cell is up for discussion and debate, and how to incentivize behavior. So I think a lot of different issues are on the table. I don't think it's as easy as just taking the amount of people in punitive seg and comparing it to the violence increase or decrease. I think there's a lot of other factors involved. And the other part of it is the really hard to manage type individuals who don't want to conform to any rule set forward. And there are those kind of individuals. And like I said, we have a duty to protect other people from them as well. So it's a challenge, but it's not something that is insurmountable. And I think that the new commissioner's perspective on it and the new administration's progressive ideas, I think, are going to give us a unique opportunity to move forward and maybe set the bar for everybody else.
Well, I hope the views and experiences of the correction officers, the frontline men and women, are taken into consideration.
Well, if I'm at the table, they will be, because I've been doing it for 26 years as a correction officer right on up the ranks. So I will certainly speak for correction officers all the time. That's what I do.
And then lastly, the issue of overtime. It's a budget issue, but I'm wondering if it's also a problem where the officers get exhausted, they get burnt out. In an environment as volatile as I imagine a jail is, that it will cause them to miss clues, miss nuances, and potentially result in either individual incidences of tragedy, like what happened with Mr. Murdo, and I don't know that overtime is involved in that at all, or broader violence. Is there anything that really can be done to try to address that overtime issue and put the resources in that are necessary to get the head count where it needs to be, so the people aren't overworked and overstressed? Agreed.
Yes, I think you can have pockets or isolated incidents of people maybe working too much overtime. I think as the chair raised earlier. And it's something we have sort of mechanisms in place to deal with that and look for it. And it's something that just has to be constantly monitored at the facility level, on the ground, by the captains and the deputy wardens and the people at the jail. But I don't always, I think at the jail, particularly at the facility levels, I think the individuals that work the most amount of overtime typically want to. It's not, doesn't mean they can't be exhausted or face, burnout, so to speak. But that's always monitored, and people really do try to keep them from going over those 57 hours, particularly in jails. I think a lot, like I said, a decent amount of the 8% might be support staff or other sort of specialists that, the only certain people can do that job type of thing. But it's something we always look at, and it's something we want to get better at. And this whole overtime reduction initiative was part and parcel of a reduction in violence for the same reasons you just laid out. Everything feeds into itself. The less amount of overtime that's spent, the less people are getting stuck, the more alert people are, not only as the officers, but the captains and the ADWs that are the supervisors. They have to be out there supervising, and they have to have the energy and the wherewithal to do that. And it's something we look at all the time in all the facilities, and it's something that we directly hold the wardens accountable for.
Well, I appreciate that, and I know this is not your first time testifying, so I'm sure that you can deduce that if, based on the number of questions you're getting about the overtime, if the officers were happy about the overtime they were getting, you wouldn't be getting these questions. So I'm sure there are...
I'm trying not to look to my right.
Well, those guys, those men and women are very important to us. I represent a lot of them.
Me too.
And to you as well.
And I would like to make the point, so when we talk about the amount of mental health inmates and the challenges, I'd like to bring out the fact that on a daily basis, with a population of 11,500 inmates, a workforce of 10,000 people, there are thousands upon thousands of interactions every day that occur in facilities, in clinics, in housing areas, in support areas, where the staff do the right thing, they solve problems, they work with the inmates, they try to figure out what they could do to help them. I've seen it over my 25 years, and I'd be remiss if I didn't get that in as well, that there's a ton of great work going on. I know we're not perfect, and I know we can get better. But the reality of it is there's a lot of people doing a lot of great things, too.
I understand that. And as I said in the beginning, it's terribly unfair that the city's failed homelessness, mental health, veterans, and criminal justice policies have turned Rikers Island into a mental health facility. And that's a terrible burden for you and your team to make work on a daily basis. But we have had some spectacular failures, and we all need to do better.
I appreciate that. And I also think that the convergence of a new commissioner and a new administration here with the policies and the progressive ideas that they're contemplating, I think is going to lend us to a really good opportunity to fix a lot of the things that you're talking about.
Well, let's seize that opportunity. Thank you very much.
Thank you, Council Member Lancman.